Fantastic Health Crusaders. Dr. Wren here with Dr. Saul Pressner, a biomimetic dentist. How you doing today?
I'm well, thanks. How are you?
I'm great. So we're here at his office in Manhattan, and actually he was the first biomimetic dentist in Manhattan. Is that right?
Yes, that's correct. Thank you, yes.
Yeah. So how long have you been here?
I've been in Manhattan over 25 years.
Whoa.
Yeah, long time.
And what is biomimetic? That's what we're going to learn about today.
Biomimetic dentistry is basically mimicking life. We try to preserve tooth structure as much as possible, avoiding potential root canals, and we try to put back in the tooth what Mother Nature originally gave us. As opposed to filing teeth down, we just try to preserve as much tooth structure as possible.
Very cool. Well, I can't wait to learn some more from you. Let's go in and see his office setup.
All right. Come on in. But that lower left molar should be restored biomimetically.
Yeah.
Yeah.
Well, this definitely seemed a lot more thorough than some of my past consultations with dentists. And let's talk about the amalgam fillings. I know there's a big concern with mercury toxicity.
Right. Well, amalgam fillings do contain mercury. They've served their purpose. I mean, they're long-lasting restorations. The problem is that they do leach mercury over a period of time. And they also cause cracks in the adjacent tooth structure because amalgam expands and contracts at a different rate than the surrounding tooth structure does. So I don't necessarily remove amalgam fillings unless I see adjacent fractures in the tooth structure or within the filling itself, because you can do more damage sometimes if an amalgam filling is intact. The more times a tooth is operated on in your lifetime, the more adverse that is for the tooth. So you want to be conservative. However, some physicians feel that amalgam fillings should be removed because of the level of mercury, especially in a patient that has a high level of mercury in their bloodstream. So if that is the case, I always consult with the physician, and then we decide what the best mode of treatment is, really.
So in my practice, I do hair mineral analysis, which gives me a 3-month metabolic spectrum into what's going on inside someone's body between the toxicity levels, the mineral depletion, over-assimilation, cortisol levels, and so forth. So Dr. Pressner, is it true that biomimetic dentistry is actually less expensive than traditional dentistry?
It is, because we're using methods that don't cost as much for the patient. It's also more conservative. If a biomimetic dentistry restoration doesn't work, if it chips, it can always be repaired or replaced. Oftentimes with traditional crown and bridge, root canal therapy may be involved and a post may be constructed, and sometimes with more aggressive treatment like that, the tooth can be lost, and then the patient may end up needing an implant, an extraction and implant. Implants don't always work. Implants really are a treatment of last resort if nothing else works. But if a biomimetic restoration doesn't work, it can usually be repaired or replaced, and you still have the tooth. So it's a win-win situation.
Smooches, because practice makes perfect, according to Dr. Saul Pressner.
Bye-bye. Thank you.